So welcome again to everyone and happy new year to everyone. And basically today I'm going live on Zoom for our inner community where the mothers who are already on a 30 days email series, they get regular they get regular instructions about how to join these sessions. And also I go live on Instagram so that more and more mothers can be helped with their questions. So first, the how I go above, I first take the questions which are already filled in the Google form, and then I take the questions which are coming live. But sometimes there are a lot of questions which are coming live, and then they go very down, like very up. So I answer them together. So this way I'll keep working and I'll keep answering, and then at the last, if any questions are left, I'll answer them also. So first, let me start with the questions which have already come on the Google form. So first question is from Manasvi. My 4-month-old preemie makes grunting sound while breastfeeding and unlatches herself after 20 seconds. So Manasvi, if your 4 months baby is making grunting sounds, there may be something like because 4 months baby. So maybe the baby is playing that time or making that sounds. And still, if you see that the baby is doing it seriously, you are not seeing that the baby is not playful and all that, and still making grunting sound, then see one thing that whether you have any overflow or milk supply. Sometimes when there is a fast flow, the babies are not, especially as you mentioned that yours is a preemie, is a premature baby. So maybe that the flow of the milk is fast, and that's why the baby is not able to gulp it faster what the baby requires. So just see that, and if the flow is all good, nothing to worry about it, then maybe there is a latching issue, because you also wrote that it's an unlatched herself after 20 seconds. So maybe that the baby is not having a good latch. That's why not getting a good milk supply, and that's why the baby unlatches. So you need to first work and see whether it is a flow issue, and if it is not a flow issue, it is a latching issue. So in that case, you can reach out to our expert who will just we have a dedicated latching expert in our team. So if you feel that there is a latching issue, you can reach out to her. She will just have a look at your latch, and accordingly she'll guide you. So I'm seeing a lot of questions coming on Instagram also. So I'll keep taking together. Otherwise, it becomes so much there. So next question is from Moni. I have no milk and my baby is 40 days old. Please help. So first of all, Moni, don't feel that you don't have milk. Mother Nature will never go wrong that you don't have any milk supply. Basically, what happens, what is the problem, that there is a gap between supply and demand. When the baby is born, there is sufficient amount of milk. But for any reason, if the mother and the baby are separated and the baby is given any top feed, there is a gap which our brain doesn't understand. Brain doesn't know that your baby is given formula feed. So the brain perceives that whatever milk supply the body is producing, it feels that it is okay. But slowly, if your demands, the baby's demand, obviously when the baby is growing, the baby demand increases. At that time, you are supplementing with formula milk and outside milk. So the brain will keep working on the same supply, because those only demands are coming. The brain doesn't know that the supply has to be increased. The baby's demand has increased. So in that way, the most important thing is supply and demand change. You have to understand that, and as per the baby's sessions, whatever other requirements, you have to try to feed the baby. And if the baby is not at all coming on the breast, then you have to express the milk. In your case, the baby is only 40 days old. So Moni, first of all, don't worry about it. If you are facing a lot of issues about you're not able to understand what is the issue, you can reach out to the team. They will help you out. Otherwise, the only thing you have to work is, for every feeding session, first try to put the baby on the breast. And if the baby cries and you have to give formula milk, then you give, but give half of the amount what the baby requires, and then take the baby back to the breast. So if the baby is not at all latching, then you can go for pumping. So this way, start on this. And along with that, I know that many of you will be asking about low milk supply. I'll cover that. So you can listen to those tips, how to improve the milk supply also. Okay. So next question is, you also said, I am feeding Similac and not mine anymore. So see, Moni, it is just 40 days old. Come on, you can work on it. And if you're not giving at all your milk, then please don't waste time in trying tips and tricks. Please reach out to the team tomorrow, get your consultation done, and resolve your issue as fast as possible, because baby is already 40 days old, and if you are not feeding at all, then it will take a lot of time if you are doing it by yourself, by tips and tricks. So better to reach out to the team and get an expert guidance so that you get your issue resolved as fast as possible. You're pumping 5 ml. Not going to help. Please reach out to the team. Next question is from Bhavna. Bhavna says, my baby is not latching and crying when I sit in the chair. If I am standing, then try to feed, she latches. What is it? But I think these questions I have already done last time. Because this question, either it is repeated. Bhavna's question. Okay, just a minute. Give me 1 minute. एक बार संजीत को पूछो, उसने क्वेश्चंस नए वाले आ गए हैं इसके अंदर क्या? क्योंकि ये क्वेश्चन मुझे लग रहा है पुराना है भावना वाला. Okay. So till then, I'll take a next question, because Bhavna's question, I think I have answered last time, that the baby is comfortable feeding in the lying in the standing position, and when she sits, the baby cries. I think I have answered this question. So let me see. Till then, I'll take the next question: how to increase breast milk? So this is one of a very common question that mothers face about low milk supply, and they feel like how to increase the breast milk supply. So first of all, low milk supply has these days become a very common issue, and sometimes it is just a feeling for the mother that she doesn't feed milk supply is there. So basically what I would suggest few things is, number one, about your hydration. Now we have to understand what is the basic concept about breastfeeding, how the breast milk is made in our body. Basically, whatever liquids we take, the body builds it nutrition and makes it milk. Now, if we don't take enough water, if we don't take enough, we are not properly hydrated. We also need water for our regular works. So if we are not taking enough water or enough fluids, the body will not be able to make enough milk. So you have to take very good care about your water intake. So these days, it is most places, this is winters. So, and in winters, we don't feel like drinking. We feel less thirsty. But for all the breastfeeding mothers, you have to properly take hydration, take good care of your hydration, so that your body can have enough liquids to make milk in your body. Second thing is about your flow of the milk. Now, bottle. Why the babies prefer bottle? Because there is a good flow of milk and good surplus amount of milk in the bottle. So now if we have to compare it with the breast, then we have to work in a way that we should improve the flow of the milk. So that's why doing oil massage on the breast and warm compress helps a lot. It dilates the vessels inside the breast, and the flow of the milk will improve. So this way, whenever the baby comes on the breast, the baby will get good milk supply. The baby will get good milk from the breast of the mother, and the flow of the milk will also improve. Now, many times what happens, babies are sleeping and they just get up in a way that they start crying and they start howling like they are so hungry for so many days. I understand. So what happens, because being a new mother, sometimes we are not able to understand the baby is now or like waken up, and now the baby will ask for milk. Suddenly the baby starts crying, and everybody in the family are after our life to give something. The baby is crying, and we are so like, we get in panic and we give formula milk. So in that case, what you have to do, if you feel that your baby has got up and baby is very hungry, then just do massage on the breast and express the milk with a little hand, so that the time of the baby comes on the breast, the baby gets milk immediately. Because the letdown will take little seconds, and if the baby has been habituated to bottle also, the baby will demand the bottle. Babies are very smart. They understand what is bottle. Whenever they are very hungry, if they are exposed to the bottle, they will look after the bottle. They will expect the bottle to be there. So that's why the mothers who face issues that my baby doesn't come on the breast, the baby only prefers bottle. Whenever I bring the baby to the breast, the baby starts crying. So in all these cases, because you would have tried previously and the baby didn't get enough milk, and the baby has understood now, so the baby starts refusing breast. So in that case, you have to improve the flow of the milk, in supply of the milk, and you have to do, if you are taking the baby on the breast and the baby is very hungry, in that case, just do oil, like just massage, express the milk, and then take the baby on the breast. Okay. And also you have to understand about the hunger cues. So there are few things about hunger cues. Babies are not able to communicate by telling that I am hungry. So there are few cues about it. So first of all, when you are rooting reflex, when you put anything around the baby's mouth, the baby moves actively towards the finger. So that means the baby is hungry. The baby is right now, this is a mid-hunger cue. So you have to work in a way that whenever you feel, I don't know whether my baby is hungry or not. In the initial few days, I understand it is something very confusing to understand. So that way you can just try this tip and see if your baby is hungry, you can take the baby on the breast. So this way you will work. And suppose your baby starts crying and you're not able to handle the baby. So in that case, instead of just stuffing your breast in the baby's mouth, you first calm the baby. First, you have to calm down. When you are so panicked, you are transferring the same aura, the same energy to your child also. Where? अब आइए 60. ठीक है. So as I was telling, so if you get so panic, you will be transferring the same aura, the same energy to your child also. So in that way, first calm down, take 5 deep breaths. It's okay. Let the child cry for some time. It's okay. It's not going to harm your child. If the baby is crying, it is going to help to clear the baby's lungs. So you don't need to be so like panicked about it. So in that case, you just calm the baby, just relax and press the breast, make some flow of the milk, and then put the baby on the breast. Okay. So this way you will be able to handle the things more confidently and you will be able to manage things more properly. So, and so I was talking about increasing milk supply. So first was hydration, second was flow, third is about obviously some galactogogues, which we suggest. So now many mothers, they feel that what home remedies can I take? So there are a lot of home remedies which you can find. They are all scattered over internet. You can read those, but you have to understand one thing. One home remedy, how are you sure that it is going to work for the other mother also? And I'm very sure whoever is sitting right now, you would have tried different home remedies. And if you're still sitting here, that means you have not got complete results. That's why you are sitting today and listening to me. So in that case, what you have to do when we talk about home remedies, I prefer if you're having low milk supply or if you're working on improving the milk supply, home remedies role will come later on. So home remedies will help to maintenance of milk supply, but when you are trying to improve the milk supply, you should take proper galactogogues. Now, when we talk about the galactogogues are the medicines for improving the milk supply. So for improving the milk supply, the most common galactogogues which are available, which have been prescribed to you by your gynecologist, by your pediatrician, by your lactation consultants, if you have consulted somebody before. So the common brands. So I will not name the brands, but all of you today, whatever brand you are using, just see the container and see if there are any preservatives added into that. So the preservatives, mostly they are like benzoates, and also they have this parabens. So you have to understand, I think all of you would have heard about that there are sulfate-free shampoos, there are paraben-free shampoos. Now, when we are not preferring shampoos without parabens for our local application, how can we take those internally? How can we take those inside our body? So you have to always be very conscious about what you are putting inside your body, especially when we talk about the galactogogues. So in galactogogues, if whatever medicines if you are taking, first of all, today, all of you see the container that it should not have any preservative added into that. So first of all, the point about preservatives. So basically, when I see the brands which are available, most of them have these preservatives added into that. So when I talk about preservative-free galactogogue, I prefer using Lactomagic powder and Morico tablets. So these two things are 100% natural with no preservatives added into that. And they are available on Amazon, Flipkart, and even on Dr. Mix website also. Now, moving further, there are some other medications also, which are allopathic medicines, but they have to be always taken under the guidance of a doctor, specifically lactation consultant doctor. So for that, I would suggest you to reach out to your lactation consultant who will write it for you. Now, this was about galactogogues. Next is by skin to skin contact. Babies, when they get used to the bottles and they get so independent in drinking bottle, so that's why when you try to take them to your chest, they just resist that because they have got used to the being independent in feeding from the bottle. So in that case, what you have to do, just try to have skin to skin contact with your babies so that the babies are bonded with you and will be able to come on the breast when you are putting them. Specifically these days it is winter, so the mother is warm. You can give the warmth of your child. That will help a lot in getting your baby back to the breast. Recently, my one of the 10-month-old baby came on the breast. She was a relactation mother, and the baby came on the breast. One recently, around a 4.5-month baby of a relactation, the baby came on the breast. So this way you can get your babies on the breast back. But the only thing is you have to follow all the things which I tell you regularly, and always it is best to have it under a guidance of an expert guide, because those are the people who will keep asking you every week, what did you do, what did you do? So that way you know that you are accountable to somebody. When you are moving alone on a path where you don't know whether that path will take you to the correct destination or not, it becomes so difficult. And as a new mother, there are so many responsibilities which you have to take care at your home also. So keeping everything in your mind, sleepless nights, the baby is crying sometimes without any reason and we are not able to understand. So that way, leave that stress on the doctor, on the lactation consultant person. Let them take the decision on how to help you out. So this way, you have to work on that. And the last thing about improving milk supply is knowing whether you are going correct path or not. And here I want to all of you to listen very carefully. Now, most of you are just obsessed about the quantity of breast milk. But have you ever thought about your baby is gaining weight? If the baby is gaining weight and the formula milk, if it starts coming down, then that means your breast milk supply is improving. It is not only about the quantity of breast milk, it is also about the nutrition in the breast milk. So when we talk about breast milk supply or breast milk quantity, you have to also keep in mind the weight of the child. If your baby is gaining weight and every week the formula milk is coming down, that means you are going on the correct path. And most of you don't check your baby's weight. So you are just dependent on the vaccinations. When you go for the vaccination, the doctor checks the weight of the baby. And then you realize, oh, my baby gained weight. Oh, my baby didn't gain weight. And even you don't know about what is the proper weight gain of your child. What should be the proper parameters, what the baby should gain weight. So that's why it is important. See, breastfeeding is a natural thing, but there are so many things involved into that, which has to be all done properly from the guidance of an expert, because this is a very short period of time. When that time passes, we just don't know. You may be realizing that when your baby is already 1 month and your 1 month has already gone. After 6 months, college will start. You have just 4 to 5 months to work on that. And then what will happen if you keep working on tips and tricks, doing this, doing that? The time will pass. And then if you're a working mom, you will be joining your office, you will be joining things, and then you will be having a lot of difficulties in working on these things. So that's why it is important, get the issues resolved, get the guidance and get issues resolved as soon as possible. So now moving further, when we talk about weight gain, so you should see that if your baby is gaining weight and formula milk is coming down, that means you are going on the correct path. Because if you're reducing formula milk, the baby's weight should come down. If the baby's weight is not coming down, that means whatever amount of milk you are giving to the child is going good, is improving. So in that way, how to check whether you are doing correct or not, you are on the correct path or not, is by seeing the weight gain. So I think you got very clear idea about working on low milk supply, and this way you can just get best results out for yourself. Now let me see next question. Next question is Mauni again. Any medicine you can suggest, please, ma'am? I didn't get your slot. So please don't worry, Mauni. Just please reach out, because medicine telling on this common platform is not advisable, specifically when we talk about allopathic tablets. For galactogogues, I have already informed about what are the galactogogues available. Next question is from Lucky Doll. Hi ma'am, मेरी बेबी अब 11.5 महीने की है और अब मिल्क फीड ज्यादा नहीं ले रही. इज इट ओके? 11.5 महीने की है ना बच्चे, तो ठीक है लकी, इट्स ओके. अभी बच्चा लगभग 1 ईयर की होने आ गई है. सॉलिड्स लेना चाहिए और बाकी आपका ब्रेस्ट फीडिंग करना चाहिए. अगर बच्चा ब्रेस्ट फीडिंग के साथ साथ, खाने के साथ साथ, अगर उसका वेट गेन ठीक है तो कोई चिंता की बात नहीं है, सब कुछ ठीक है. नेक्स्ट क्वेश्चन इज from Atisha Jain. What to do if breast is heavy while weaning? Okay, so while weaning, if you're feeling that the breast is becoming heavy, then you have to follow the block feeding process. So block feeding is a process in which what you have to do, you have to feed the baby, but when you feel the breast is heavy, so in that case, just sleep for some time. And if it becomes very difficult for you, just express by hand. That's all. No pumping, no feeding the baby just to get relief of it. Just hand express, and when you feel okay, you just leave it. So there is again the reversal of demand and supply. If the milk is not taken out regularly, the milk remains in the breast. The brain takes it as an extra milk and it will start reducing the milk supply. So don't worry about it, Atisha. Just slowly keep moving. If it feels very uncomfortable, you can just express the milk by hand. That's all. Okay. Next question is next question is from Rida Fatima. How to increase the milk flow instantly when the flow suddenly drops? So basically, by improving the flow is most important. By doing, like, you can improve the flow by doing oil massage on the breast and doing warm compress. The flow of the milk will improve. Next question is from Meena. Bottle feeding baby. So what is the question, Meena? It is just written bottle feeding baby. Please write your question properly so that I can answer it. Next question is from Divya. Is it possible to make a baby who was bottle fed for 6 months to deep latch and breastfeed directly? So Divya, see, when we talk about bringing the baby from the bottle towards the breast, we need to have great patience into that. In that case, what we need to understand first, then when we are trying to put them on the breast, we need to first of all calm and take out from our mind that it is impossible. Most of you most of you just feel that is it possible. Everything is possible when you are working with a good mindset, with a positive mindset. As I told you just a few minutes back, that one of my 10 months old baby came on the breast pack. But it is not compulsory for every baby to come in, because there are a lot of factors into that. You need to work first of all positively and just have lot of skin to skin cuddling with your child, and specifically during night time when they are sleeping, or when they are having their naps. That time just lie with them. You have to spend time with your child. If you're too busy, if you're busy with the family, with the family course, there are a lot of things if you're handling, then it might become a challenge. You have to get sufficient time to your child. If the baby has been on bottle fed for last 6 months, it might be a challenge, but it is not impossible. You can work on it. You can do lot of skin to skin with your child, put the baby on mid bottle feeding, as I have advised many a times. Just work on that, and definitely there are very good chances you can bring the baby from bottle towards the breast also. Okay, so next is, मैम ब्रेस्ट फीड नहीं है, मैं पंप करती हूँ और वो अब 200 ml से 100 ml पे आ गया है, ओनली 2 to 3 times. अगर 100 ml 2 to 3 times अभी भी आ रहा है, और उसके साथ साथ में बच्चा अगर ऊपर का खाना खा रहा है, उसका वेट गेन ठीक है, तो लकी ज्यादा परेशान नहीं हो, तो ठीक है वो सब चीजें. क्योंकि देखो एक चीज और भी ध्यान रखो, जैसे जैसे आपका बच्चा बड़ा हो रहा है, आपके मिल्क का कॉम्पोजिशन भी चेंज होगा. तो इसलिए क्वांटिटी को देख करके परेशान मत हो. अगर आपका बच्चा सफिशिएंटली पेट भरता है, उसका रिलैक्स्ड है, खेलता है, एक्टिव है, तो यानी कि टोटल फीडिंग जितना वो ले रहा है उसके लिए सफिशिएंट है. Next question is from Preeti. How to increase the milk, ma'am? I have just answered in detail about how to increase the milk supply. You can see the recording. So the recording will be available either on YouTube, my YouTube channel. So my YouTube channel is in the name of Dr. Tanima Singhal. You can just type on YouTube, you will get my channel. And there are a lot of videos which are very helpful for new moms. So you can watch the recording of today's session, and also it will be available on Instagram feed. Next question is from Aishwarya Shinde. If the baby is on both breastfeed and formula, how much quantity is supposed to be given in formula milk for 2-month-old baby? So a 2-month-old baby should gain 200 grams per week. So whatever formula milk you are giving right now, you just see the baby's weight tomorrow and then after 7 days. If your baby is gaining more than 200 grams per week, start reducing the formula milk. Now, there is no fixed quantity of formula milk which one child should have. See, every baby is born with different birth weight. So if the birth weights are different, if every child is different, we can't just fix the quantity of milk which every baby should take. So don't worry about how much quantity you should give. You just see the weight gain of your child, and then accordingly you just change the quantity of formula milk. If by reducing formula milk your baby keeps gaining 200 grams per week, that is a perfect thing for you, Aishwarya. You can just reduce formula intake with this same thing. Next question is from Preeti. How to avoid formula and start increasing breast milk? Same question, Preeti. Please see the recording of this session. It will be available on Instagram and YouTube very soon. Aishwarya says again, formula milk is given only 3 times a day. Rest baby is dependent on mother's feed. Same thing, Aishwarya. Just check your baby's weight for 1 week and see if the baby is getting more than 200 grams. You can start reducing formula milk slowly. Next question is from Atisha. My breasts are getting hard. What to do while weaning? I tried ice pack. So that's what I said. You see, if you try ice pack, you will not be able to express the milk. So it's better to do massage and compress and then just try to hand express. And just express till you feel comfortable. Once you're comfortable, you just leave. So if the milk will remain in the breast, the brain will get the signal that this is an extra milk and it will start reducing the milk supply. Next question is from Aisha Khan. Hello, ma'am. I do pump to increase the milk supply. Okay. What is the question, dear? So Atisha says, is it okay to stop breastfeeding baby on 14.5-month baby? So Atisha, see this for this, I would say, see, WHO says breastfeeding can be continued 2 years and above. I say that it should be a decision of mother and the child. If the mother wants to breastfeed, if the baby wants to breastfeed, you can continue for as long as you want. There should be not a third person to tell you whether you should breastfeed or not. So when you are trying to wean off, first see whether it is your decision or somebody has asked you to do that. Now 14.5-month baby is a very small baby. You can continue breastfeeding and just relax. But if you want to wean off, then just keep doing which I suggested right now. But if you are ready to breastfeed, if your child is ready to breastfeed, please continue breastfeeding. Next question is from Aisha Khan. But every bite, everything just 30 ml comes down. So when you say when you are pumping and 30 ml milk is coming down, but if you're not giving any formula milk and the baby is gaining weight, then it is perfectly fine, Aisha. Next question is from Atisha. Atisha, write in one thing, because when there is a gap, I'm not able to have that flow of what you are saying messages. So you said that you wanted to know about 14.5-month baby should wean off or not. So if I stop feeding for 2 days, then can I feed after 2 days? So yes, see, it's 14.5 months, you don't need to breastfeed the whole day, like every 2 hours. So the baby is already taking solids also. So whatever amount of feeding she's taking, and if you're comfortable feeding her, please continue. No need of getting getting to weaning if people are suggesting you to wean. Please take the decision, take an informed decision. Don't just wean off because people are saying. Take it as your own decision. If you want to wean off, you're not comfortable feeding your baby further, then only go for weaning. But if you're comfortable feeding, if your child is wanting you, please don't wean off your child. Okay. The next question is from Monica. Low breast milk supply and baby not latching. For low breast milk supply, please see the recording. For baby not latching, I'm going to give you the tips for how to latch your baby. Now, first of all, let's understand the position of the mother. The mother should, first of all, sit straight. She should not bend forward, because if you bend forward, there will be chronic backache and you will not be able to continue for a longer time. So first of all, when we talk about the positioning of the mother, is first of all, you should sit straight. Second thing, have your baby on your lap with pillows below you. Many times I see most of you are holding your baby with your hands directly. Your hands will start paining, girls. Don't do that. Have proper pillows, and not only one. You can have lot of pillows and have a good height of your child, so that the baby comes up and towards your breast and you don't have to bend down to feed the baby. So have your baby the sufficient height for your child. Then second thing is your baby's positioning. Your baby should be feeding by facing towards you. It should not be like the baby is lying like this. Your baby should look towards you. So ideally, the mother's tummy and the baby's tummy should be touching each other. Okay. So the baby should be facing you. Next, how we have to hold the baby. So there are like many positions, but which the favorite position for mine is the cross cradle hold. So I'll tell you about the cross cradle hold. Now, when your baby is turned towards you, then suppose you have to feed from the left breast, then hold the baby with the right hand. And how? Like if your baby is like 1.5 months or 2 months old, then you can hold the baby like having the full body in your hands. But if your baby is more than 2 months old, then what you can do from the shoulder, you just bring your hand from above the shoulder. Now, from above the shoulder, you hold the baby from your palm. Your baby's head should be in your palm. Now, why it is so? Because babies during feeding time, they pull themselves back. When they pull themselves back, that pains the mother, and also they come on the shallow latch. So that's why just hold them with your hand. And what you have to do, you don't have to hold from the neck. You have to hold behind the neck, behind the ears, and hold them behind the ears. Next is just putting this chin little up by extending the head. So how you will do that? By this wrist. Just move the wrist back. So when you move the wrist back, the baby's head will go like this. Now there is a very good reason why I'm telling you. Now suppose you have to drink liquids. And if you have to drink any liquid and you're looking down, imagine that gulping will become so difficult for you if you're looking down and drinking water or drinking any liquid. So imagine the same thing for the child. When your baby is looking down and feeding, it will become so difficult for the baby to gulp. But if you are looking up and drinking, it will become easy for you to gulp. So the same thing when you're putting the baby on the breast, just extend the baby's head like this. So that you can do by this wrist movement. So just take with your wrist, go just take the baby's head back so that the neck opens up. Now, there are two benefits with this. When you do the head back, the chin will touch the mother's breast. Chin is hard and that gives a natural compression on the breast for a good flow of breast milk. Second thing, nose will be back. And I know most of you will be concerned. My baby's nose shouldn't shouldn't be pressed. बच्चे का नाक तो नहीं दब रहा है. Everybody is concerned about the nose. So by doing this thing, you will be relaxed. Your baby's nose is away from the breast. So you don't have to worry by looking downwards. नाक तो नहीं दब रहा है, नाक तो नहीं दब रहा है. That way, you will not be worried about it. So this extending of head is very good and very helpful when you are latching the baby. Now, once you latched, now what will happen? The baby's head is back, chin is front, nose is away from the breast, and forehead is away from the breast. You can see your child. Now, what you will see once you latch the baby. And now for latching techniques. Most of you, if you are doing cross cradle hold also, you are holding the breast in C shape from sideways. It is not going to help you. Why? Everybody, please focus here. Now, how do we eat vada pav or burger? By this, like this. We hold the vada pav or we hold the burger like this. And we press press the burger like this and we take a big bite. And we have a big bite. Now, just imagine your baby on the breast. Okay. If you hold the breast like this, C shape, and your baby is coming like this. Okay. If your baby is coming like this, your baby is lying. So when your baby is lying parallel, imagine the lips of the baby. The lips of the baby are like this. So the lips of the baby are like this. Your hands are like this. See, they are perpendicular. So it is the same thing by how you are eating the burger. If you're eating the burger like this, will you be able to take a big bite? No. That's why when you are holding the burger like this, you will be able to have a big bite. So same thing, when you're holding the baby towards your breast, you have to hold the breast in U shape from below, not C shape from side. So when you're holding the breast in U shape from below and your baby is parallel to you, the lips of the baby will be like this. So they will become parallel. Now, the same thing. You have to just press the burger to have a big bite. So when you're holding the breast, press the breast equally from both the sides. When you're pressing the breast, there will be a pout of areola. And you have to latch the baby with the areola, not with the nipple. Many of you today question, flat nipple, ma'am, can I feed? Inverted nipple, ma'am, can I feed? Ma'am, I have very small nipples, can I feed? Yes, you can feed with any kind of nipples. Basically, you have to feed the baby with the areola and not the nipple. So, by this, when you're holding the breast in U shape from below and pressing the breast, there will be a pout of breast with a pout of areola, and the baby will be able to latch on that. Now, a very important factor here. You don't have to give full areola in the baby's mouth. I know many of you would be thinking, Arey, I have a big areola. How can I give full areola to my child? I know these questions of yours. So before ask your thing in your mind, I have a big areola. Don't worry. You don't have to give full areola in the baby's mouth. You have to give only lower part of areola. So for that, what will happen? The initial thing, when you have extended the baby's head is like this. When you are bringing the baby on the breast, the lower lip will be on the junction of areola and breast, and the upper lip will be just resting above the nipple. Okay. So once you just latch the baby in that way, your baby will be able to have a position like the portion of only lower part of areola. That way, the baby will be having good part of areola, and lower part of areola has bigger vessels of milk, so that good amount of milk will be in the baby's mouth. So as the baby starts sucking, the flow of the milk will be there for the baby, and the baby will empty the breast faster. Now from here itself, let me tell you one more thing. Many of you say, my baby keep feeding for 40 minutes, keep feeding for 1 hour, still my baby is hungry. Girls, your baby cannot feed for 45 minutes, 1 hour continuously. You would be seeing that your baby sleeps on the breast. So if your child is sleeping on the breast, that means either the latching is not fine, or the flow is less, or the supply is less. So in that case, if you see that the baby is sleeping on the breast, you just remove the baby from the breast and see the color of the milk. If the baby has finished breast, the color of the milk will become translucent. But if you see that the thick milk is coming, that means the baby has not emptied the breast. The baby will ask for feed again. So that's why this will make sure that whether the baby will be getting up now in some time itself, or the baby will sleep for a longer time. This way you can have the control of your breastfeeding journey in your hands. You don't have to worry about people telling you whether you are having enough milk or not. Just take all the control in your hand, how to manage your breastfeeding journey. Also, if you see that the baby, and yeah, so also I want to tell you about active feeding and passive feeding. So when your baby is feeding on the breast, you have to see the neck, because when you're gulping, when you're drinking any liquid, you will see the this movement of neck, the, this gulping movement you will see. So if your baby is feeding and you are seeing the gulping movement, that is an active feeding. Continue feeding from the same side. But if you see that the neck movement is not there, that means the baby has slept. You don't have to keep sitting for the same position. Just unlatch the baby and let the baby, just put the baby on the bed. Okay? Just a minute. So I hope that got very clear about latching. Okay. Next question is from Tanima Bhattacharya. Oh, great. Good to have same name mother here. So if you are live, you are seeing myself. So high five, Tanima. Okay. So Tanima Bhattacharya says, my daughter is 6 months old. She's annoyed when I try to breastfeed her. My milk supply is very low. What to do? So first of all, as you know, the milk supply is less. You already feel that the milk supply is less. And obviously she's annoyed. She's 6 months. She understands milk. She understands the flow. She understands amount of breast milk. So first you have to work on improving the milk supply. And once your milk supply is good, you can even try putting her on the breast. Okay. So today I've given a lot of tips about how to improve the breast milk supply. You can watch the recording. And still, if you feel, because 6 months have already passed, Tanima, so I would suggest reach out to the team and get your consultation done so that you can improve your milk supply faster. Okay, so next question is Preeti, ma'am, one more doubt. My breast milk is watery. Is it fine? So, see, always remember milk is in two parts. First, fore milk, which is watery, and then it is hind milk, which is thicker. So, Preeti, don't worry if your breast milk is watery. It will be in the beginning, it will be watery. But once the fore milk goes away, there the hind milk will come, which will be thick. Don't worry. You can just see by the color. The first will be like translucent, and then it will become thicker. नेक्स्ट क्वेश्चन इज फ्रॉम अनविनी। मैम, बेबी के गले में सर्दी जैसी आवाज आती है तो उसके लिए क्या करें? बच्चे को अगर सर्दी हो रही है तो फौरन बच्चों के डॉक्टर के पास, ये ऑनलाइन आप ये सब चीजें प्लीज ना सर्च करें। छोटे बच्चे हैं उनको डॉक्टर को दिखाइए। बच्चे को फौरन निमोनिया हो जाता है, बहुत छोटे बच्चे होते हैं। प्लीज अगर सर्दी जैसी आवाज आ रही है तो फौरन अपने पीडियाट्रिशियन को जाके दिखाइए। और कल ही जाइएगा अपनी ये इस पे ऑनलाइन ये सब चीजें सर्च मत करिए। कल ही अपने डॉक्टर के पास लेके जाइए और बच्चे का फौरन ठीक से इलाज करिए। नेक्स्ट क्वेश्चन, अवनी कह रही है सर्दी नहीं है। सर्दी नहीं है तो क्या हो गया बच्चा, क्यों आवाज कर रहा है आपका बेबी? फिर गले में सर्दी जैसी आवाज आती है। सर्दी जैसी आवाज क्या होता है बेटा? डॉक्टर के पास गए थे, उन्होंने कैल्शियम आवाज दिया था। कैल्शियम से देखो, ये चीज देखो, एक बार देखना पड़ेगा ना क्यों क्यों आवाज आ रही है। अगर आपके डॉक्टर ने बोला है कि कुछ भी नहीं है, तो थोड़े बच्चों की आवाज होती है, वो दूध पीते समय या कुछ करते समय थोड़ा गड़गड़ाहट रहती है। अगर आपने अपने पीडियाट्रिशियन को दिखा लिया है और पीडियाट्रिशियन ने बोला है कि सब कुछ ठीक है, तो फिर मत परेशान हो इसके अंदर। ठीक है, अगर पीडियाट्रिशियन को दिखा चुके हो कि वही गड़गड़ाहट कुछ भी नहीं है और आप कह रहे हो कि डॉक्टर ने बोला है कुछ भी नहीं है, बहुत अगर लग रहा है कि क्या प्रॉब्लम है, तो एक बार सेकेंड ओपिनियन ले लो, एक बार सेकेंड एक डॉक्टर को दिखा लो। बट इस चीज को लेकर के देखो, इंटरनेट पे पूछने से कैसे पता चलेगा, क्योंकि किसी ने आपके बच्चे को देखा तो है नहीं, उसकी आवाज भी नहीं सुनी है। तो फिर आप अलग अलग लोगों से पूछोगे, अलग अलग लोग राय देंगे आपको। अगर आपको लग रहा है आपके पीडियाट्रिशियन ने बोला है कि कुछ नहीं है, पहले तो रिलैक्स हो। अगर फिर भी डर लग रहा है कि पता नहीं कुछ और चीज तो नहीं है, एक सेकेंड ओपिनियन ले लो। अगर दो डॉक्टर्स बोल रहे हैं कि कुछ भी नहीं है, तो फिर परेशान मत हो। ठीक है, ठीक है, चलो नेक्स्ट पढ़ते हैं। फ्रॉम भूमिका, लो मिल्क सप्लाई। Already answered Bhumika. Just watch the recording if you have missed the session. Next question is from Rihanna. Latching issue with क्या लाइव डेमके? लाइव डेमके क्या होता है? Next question is from Rakhi. How to increase breast milk supply? Already answered Rakhi. If you have missed the session, please see the recording. So recording will be available on both my YouTube channel and on my Instagram channel. Next question is from Jyoti. Ma'am, why my 1 month 10 days baby child is not reached to his birth weight, even that is 2.8 kg? He's taking breastfeed whole day every time on demand. So first of all, Jyoti, if your baby is 1 month 10 days and not reached birth weight, this is a serious thing. You need to work very closely with the doctor. Your baby should gain 200 grams per week, and if the baby is not reached the birth weight also, please, this is something very serious. Okay, if the baby is on exclusive breastfeeding whole day on demand, that means the baby is not latching properly. The baby is not getting the hind milk, which is at the back. So milk is in two parts, fore milk and hind milk. Fore milk is watery, which is loaded with proteins, loaded with the antibodies. But the weight gain of the baby will come with the hind milk, which is at the back, which is the thicker milk. So every time when you are breastfeeding the baby, just see color of the milk. And I'm very sure your baby is not taking the hind milk. So for every feeding session, check the color of the milk. The thicker milk you have to give to your child. And if your baby is not taking that, please express it and give it to your child. But Jyoti, if you're live and if you're watching this, if you're even watching the recording, this is something not good. Your baby is already 40 days old and not reached the birth weight. Please, this is something very serious. Please reach out to your team, to your to your doctor, not your team. And if your doctor suggests you that give some hind milk to your child and you are not knowing how to do that, please reach out to the team as early as possible. Work with the team and get your baby's weight increased. Next question is from Janani. Please help me with the food chart to increase my breast milk supply. Currently, I can make only 10 ml of breast milk on each feed. Beta Janani, if by eating any particular food, the milk supply could have increased, then most of you who are sitting here, wouldn't be sitting here. They would have just eaten something and milk supply would have increased. So milk supply is not dependent on what you are eating. It is not going to like just work on the food chart. So Janani, please watch the recording. If you're live here, you would have heard about it. And if you're not live, you're watching the this recording, then please work on improving the milk supply with the tips which I have told you. And if you have tried everything and still not improving, please get the expert guidance. Next question is from Supriya. Is it possible to restart baby after 1.5 years? Yes, definitely you can increase the breast milk supply. And one of our baby, during COVID time, she was really worried about her baby's immunity. She reached out to me to start relactation for her 2 years old baby. And successfully we reached up to from 0 to 370 ml of breast milk for a 2 year plus child. And you can watch this whole story of this journey on my YouTube channel. Just type relactation and you will get a lot of videos of success stories on my YouTube channel. And this particular YouTube story has like reached a lot of mothers and it motivated so many mothers. So it's in the name of Kiran. My patient from Kiran, she is from Panchkula, Haryana, and her breastfeeding success story is available on my YouTube channel for relactation for 2 years plus baby. So you can watch that on my YouTube channel and you will get inspired from her. She's such a positive girl. You just watch her story and I am very sure it will motivate you to work for improving breastfeeding supply. Next question is from Bhavna. While breastfeeding, my baby is crying, although my breast having milk. Why like that? So see if there is a bigger gaps in your feeding sessions. So if your baby is becoming very hungry, the baby will become very cranky. So make sure that you are frequently feeding the baby so that the baby doesn't become too hungry. So you have to follow the hunger cues of your child. So whenever you are not sure whether the baby is hungry or not, just try putting something near the baby's mouth. If the baby moves actively towards that, that means the baby is hungry and just feed the baby. Next question is from Priscilla. What's the effective and quickest way to relieve clogged lump and what's the reason for it to occur again? So let's understand about clogged lump. So if it is a clogged lump when you are talking, so lump will be, you can easily resolve it by doing warm oil massage and then warm compress. And with the comb, the normal comb, the bigger teeth, you just put it on the chest from shoulder towards the nipple. Just move on the lump and feed your baby. So when you are doing that, the baby will suckle the breast and the milk, the lump will dissolve. And if you are having this frequently, either your baby is not emptying the breast properly, not latching properly, or your milk supply is very good. It is an over milk supply. So if you have an oversupply of milk, then you can just express the milk after feeding sessions so that you don't have this clogged duct. Also, there are many mothers who get lumps in the axilla. So if you have the axilla lumps, then don't put your hand up while sleeping. So many mothers have a tendency of putting their hands up while sleeping. So please don't do that. That will cause lumps in the axilla. Okay. Next question is from Kajal. How to know that baby's stomach is full while breastfeeding? So your baby will be happy, the baby will sleep, the baby will play. So you will understand your baby's stomach is full. Next question is from Srilata. If baby is 8 months old, we can start the relactation. Is it possible we can increase the milk supply after 8 months if the baby is not latching? Yes, Srilata, you can definitely increase the breast milk supply even for 8 months baby by a process of relactation. And I just told you about relactation for a 2-year-old baby, baby's mother. And we reached from 0 to 370 ml of breast milk per day. And the success story is available on my YouTube channel. Just type relactation Kiran and you will get her story. Next question is from Richa Sharma. How to open pores of nipple as white layer is seen on some pores. So just you need to have little warm water, add some salt into that, and just with this cotton, just you can apply slowly on the on the nipple pores if you are seeing whitening is there. Also, the thing is having good flow. So by improving breast, by doing oil massage and by doing what you are saying, I'll answer that. Wait. So by doing oil massage and by doing warm compresses and feeding the baby with that, so what will happen? That will improve the flow and the pores will open up. Next question is from Deepika. Despite of using lot my medicines, I am unable to increase my breast milk. My child is 4 months old and my milk supply is less than 30 ml per day. Please help. So Deepika, today I have answered in detail your question about improving the milk supply. Please watch the recording. And if you have tried everything and still not working, and you've already tried everything, please reach out to the team for the expert guidance. Don't depend on tips and tricks. Reach out to the expert guidance. Next question is from Sadhna. While breastfeeding, my baby pulls her head back forcefully with my nipple inside her mouth. Sometimes nods her head or rubs her face to my breast. What's the reason for this? So I don't know what is the age of your child, but I feel the baby will be more than 2 or 3 months. So if the baby is doing like that, just follow a cross cradle hold. That will help your head to be firm, like hands to be firm on the baby's head, so the baby doesn't move. And if you're feeling that the baby is doing that and becoming restless, that means either the flow is less or the supply is less or the latching is not correct. So if you're an exclusive breastfeeding, your baby is gaining weight, then obviously your supply is good. Only we need to work on flow and on the latching position. Okay. Next question is from Alpenliebe. Nice name. So after how many days of C-section, I can start my normal diet? Hey, what is the problem in the diet? You can have your normal diet now also. Like there is no hard and fast rule about C-section. Just 2 days they ask you to be on liquids or on normal diet. Otherwise, it is perfectly fine. Next question is from Sagu. Hello, ma'am. My baby only latches from right side of the breast, not from the left side of the breast. From left side, my milk supply is very low. What to do, ma'am? How to increase milk supply? My baby doesn't take bottle. So what you have to do, first of all, whenever you are trying to put the baby on the breast, first put the baby on the side where there is less milk of there is less supply of milk. Let the baby suckle for few minutes. When the baby starts crying, take the baby on the other breast where the supply is good. Let the baby have enough amount of breast milk from the same side. Then when you are just putting the baby on the, just removing the baby, take the baby one more side on the side where the supply is less. The basic concept of doing all this is more demand, more supply. So on the left side, when there will be more demand, the supply will definitely increase. And if your baby is not at all coming on on that side, then you can pump from the left side where the baby is not ready to latch and the supply is less. So this way, the more demand, the more supply will be there. And you can just follow the tips and tricks which I just gave in this today's session about how to improve the milk supply. So this way, you can just work on it and improve your milk supply. Next question is from Nehal Mahindra. Ma'am, does breast has air if there is no milk? If yes, then how to save baby from colic? Cute question. Your breast don't have air instead of milk. Relax, Nehal. It is perfectly fine. There is nothing like. Oh, so your basically question is, how does the baby gets colic? So now let us understand how the babies get colic even with breastfeeding. So if the baby latches in a way that there is air coming down from the sides of the mouth, so the baby during the feeding session will suck air. So when the baby is sucking air, the baby will have colic. So that is why that is a very important thing. That is, there is the most important thing is to latch the baby deeply with a deep latch. And today I have given in detail how to latch your baby deep. So that way you just need to work on the deep latch and the baby will not suckle air with the feeding session and the baby will not have colic pain. Next question is from Alpenliebe. I meant, when can I start some junk or aerated drinks? Ah, you wanted to ask junk food from me. Okay, very tricky you are. So junk food and aerated drinks are not allowed even for anyone. So occasionally when you talk about junk, so what I can say, this is a very tricky question. So mothers, so you want to have junk food and aerated drinks. So you are smiling. I know you put me in a position there. So when I talk about junk food, see, we can take a midway. If you want to have burgers or if you want to have noodles, you can make it at home also, na? You can have those things at your home. I know you will say that taste doesn't come. So it's okay for few days till you are breastfeeding, or till you are basically, for outside food, it is about the hygiene, the most concern, the big concern when I talk about. So the hygiene part, if you are taking it from, even from very good hotels, their kitchens are also not that clean as what we clean in our houses. So that's why the most important concern is about hygiene and the kind of oil they use for making those food they make outside. And also for Chinese food, when I talk about, they add ajinomotos, which are not healthy. So basically, Alpenliebe, your name is also Alpenliebe. Huh? So you are all about junk foods when you're asking. So you have put your name also as Alpenliebe. So anyhow, what I would suggest, if you want to have anything fast food or something, I would prefer having it at your home. And about aerated drinks, even you can have the colas you can make at home also. These days, very easily, you can get this one. What do you call? As that layer kind of a thing will come in the market, you can just make at your home. So basically, because I'm just concerned about the hygiene, which is made outside food. So all these things you need to work upon. Okay? Difficult question to answer about junk food. Okay. So Nehal says, is burping required breastfeed if baby is latching good? I mean, yeah. So burping is required. Now I have good question, Nehal. One thing I want to tell you all. So many of you are so much about burping. Should I do burping or not, or something? So let's understand what is the concept behind burping. So when our tummies, anybody, so for babies specifically, because they're lying on at one position. So what happens? The air is formed in there, because obviously that is an empty stomach. So air is formed. And when we drink anything and when we give them milk, that air is displaced. Now, if that air is displaced and if it comes out later on, when we put the baby on the bed again, so with that, there are chances of throwing the milk out. And sometimes if it goes into the trachea, the air, then there are chances of blocking. That's why we are so concerned about the burping. Now, that air can be displaced in two ways. Either the baby has burped, or sometimes the baby's fart. During your feeding session, if the baby farts, and many times this is very common for mothers to see that the babies are farting during their feeding sessions. So if their baby farts, that means the air has been displaced. So if your baby during feeding sessions, if the baby farts, then you don't have to like compulsory burp them during those sessions. So this way, when you talk about breastfeeding, burping, then if your baby has then farting, then it is fine. But if the baby has not farted, then obviously you have to burp every time. Okay. And even when you say about latching, baby good latch, maybe a shallow latch, but burping is required because you have to displace that air. The main thing is about displacing the air. Okay. So Nehal says, I had session with you today and I have already started with the protocols you have shared. Fingers crossed for the positive results. Great. Nehal, but I think you had the session with any of my doctors. I don't think you had a session with me, because I remember, Nehal, you would have any of the session with any of my doctors, dear. Hmm. So Alpen says, thank you, ma'am. And Alpen Libe, that means you should take proper care. Next question is from Megha. My daughter is 26 days old. I don't have any milk supply and I have flat nipples. Is it possible to make her breastfeed, or is it too late? Are 26 days old? It is not late. Who told you late? 26 days old. Just come on, Megha. Don't be so demotivated. 26 days old. Are easily we will do it. Come on. And about flat nipples, please don't worry. I have given in detail about flat nipple, inverted nipple, all these things I have discussed in this channel, in this session today. Please watch the recording. And for you, I want you to watch the recording so that this feeling from your mind should go off that the baby cannot, you have low milk supply or for 26 days old and is it late? Okay. So now let me start the questions from here. So first question is from Nivedita. Is it possible to relactate after 3.5 months? Yes, definitely, Nivedita, you can relactate for 3.5 months. It is so easy for 3.5 months baby to relactate. Don't worry. Megha says, thank you. Most welcome, dear. Next question is from Rihanna. How much time to take for increasing breast milk? That will depend from mother to mother. If the baby is on exclusively like a formula feed and you have to improve the milk supply, then obviously it will take more time. If the baby is on mixed feeding, it will take lesser time. Next question is from A Mega. You are there also and you are here also. That's great. You are both the ways. So I'll answer the questions here also. Don't worry that I'll not answer the question here. So you were smartly moved from Zoom towards the Instagram also. Okay. So Megha says my daughter will be a month old in 4 days and my milk production is next to nil. I have flat nipples. So already answered Megha. Don't worry, just watch the recording and you will definitely. And you were here till from 8 p.m. I have answered today, Megha. Then also you're worrying about it. Don't worry. You can definitely improve milk supply. Next question is from Ankita Shastri. Hello, ma'am. First of all, thank you for the work you are doing. I took consultation on 4th January, waiting to start the therapy. But just by watching your videos and Momstar series, it gave me hope and confidence to work on it to be able to breastfeed my almost 1.5-year-old month baby boy. Awesome, Ankita. I'm so happy. I'm so happy that the work which we are doing and the Momstar series which we are doing is motivating you all. I am really looking forward for your awesome feedback about your exclusive breastfeeding. And I hope and I wish to see you in the Momstar series very soon. Next question is from anonymous attendee. Any specific feeding position advised if you have sagging breasts? So for sagging breasts, cross cradle hold will work a lot, very well, I mean. So I have given in detail about the cross cradle hold today. Just watch the recording. And if you're talking about still if you find difficult with the sagging breast, then you can go for this one, football hold. That also works very well for sagging breast. Next question is from anonymous attendee. How much milk supply is required for 2 months, 10 days old? So I have already answered this question. Next question is from Ankita Shastri. My question is that my baby is on formula from day 1. Now from 22 to 3 days, he's not drinking same quantity every time. Sometimes he drinks 60 ml and sometimes 120 ml and sometimes even less, around 30 ml. Why he does so? When should I feed him? I am feeding on demand and always keeping an eye on time gap. That varies from 45 minutes to 2 to 3 hours and 4 hours too. So first of all, Ankita, now, if full day, let's imagine you're eating or your husband's eating or anybody from your home, any adult who is eating food. You are not taking the same quantity of food full day. Maybe in the breakfast, you're eating more and dinner, you're eating less. Maybe in the breakfast, you're eating less and dinner, you're taking more. So when as adults, we are not taking the same amount of food the whole day, then how we expect our child to have the same quantity of milk every time? First, this is the answer for your first question. Second thing is, when should I feed him? That you're already doing good, that you are giving him on demand, but there is nothing like just don't see the clock. As you say that I keep an eye on 45 minutes to 2 to 3 hours and 4 hours too. Just relax. It's a natural thing for the baby to ask for milk. Whenever the baby asks, you just give the baby on demand. Now, as a mother, I understand we just get worried whether is it enough for our child or not. For that, the doctor would have also told you to check the baby's weight. So when you're seeing the baby's weight, your baby is just 23 days or 2 or 3 days, because there is no gap. I am not understanding what is the age of your child. So anyhow, when you see the weight gain of 1 week, we will be able to tell you is the baby gaining weight fine or not. If the baby is gaining weight perfectly fine, then you don't have to worry about the clock. You just feed the baby on demand and relax, Ankita. Okay. So basically, breastfeeding is not about just being so stressed out every time. It should be a journey which should be enjoyable by both mother and the child. And that will happen only when you know the basics of breastfeeding. So keep coming in these sessions, keep discussing with our doctors, and you will definitely get confident. You will be able to have a confident breastfeeding journey. And I want all of you to understand one thing. Breastfeeding is something which you should always be an enjoyable thing for you. When you remember, when you see your child going to college, you should remember this time and imagine I was holding my child so close to me and was having so many difficulties at that time, but at last I sailed through. So you should not be like, oh, thank God that time passed. It should not be like that. So you should enjoy your breastfeeding journey and you should be so proud of it. Whenever you think about it in future, you should have a smile on your face. Not, oh, thank God it passed. It should not be like that. So for that, you need to train yourself. You need to have good knowledge about it, about breastfeeding basics, and keep coming in these sessions. I take it every Fridays, and keep coming and keep taking guidance from me. Next question is from Yuthika Rao. Hello, ma'am, Yuthika here. My 15 days baby is not latching properly, and now the problem is I'm not getting sufficient milk. What to do? So first of all, you've answered it because there is a less demand, so the supply has gone down. So you can reverse the process back by improving the supply-demand chain. And Yuthika, today I answered in deep about how to increase the milk supply. Please see that, but your baby is just 15 days old, and when the babies are less than 1 month, I feel so like the easiest thing to improve milk supply is less than the babies who are just less than 1 month. So just try for a few days by yourself, but if it is not working, please reach out to the team fast so that we can improve the things fast. Okay. Next question is from Saranya. Ma'am, I'm second time mom. He's 4 months old. When I pump, I get 30 ml per pump. What can I do to please suggest me, ma'am? So if your baby is 4 months old and you're getting 30 ml per pump, and if you're not giving any formula milk, then don't worry about improving the milk supply. But if you have to supplement the formula milk, then obviously you need to work on improving the milk supply. So it is not only about the milk supply, also by improving the quantity of breast milk both. So today, Saranya, I've given in detail about how to improve the milk supply. Please see the recording because it will be very difficult for me to repeat the same answers again and again. You can watch the recording and it will be available on my Instagram and YouTube channel both. So please watch the recording and you will get answer of your question. Next question is from Anu. Ma'am, my baby is 4 months old and she's stopped feeding. I want her to do breastfeed. Is it possible? Yes, definitely. 4 months old baby, you can definitely breastfeed. Don't worry about it, Anu. Next question is from Nehal. Ma'am, what all is missing from formula milk that breast milk has so much inclination? Asking for knowledge. The most important thing, the formula milk which is lacking is immunity. Formula milk is made with, and also formula milk has preservatives into that. Do you think, and one more question, all of you, please just think about it. See, what is the source of formula milk? Just think about it. And if you can answer, write in the chat box, please write. What is the source of formula milk? If you feel that it is a dehydrated milk powder, do you think we have so much of milk available in the world to give it for adults and to make so many formula dabbas also? Think about it once. We are so concerned about our babies, so many things about the pillow, the clothes. It should be the softest clothes. It should be the best cotton. It should be the best toy for our child. Everything we are so concerned. But what we are giving them inside, what we are giving them as a foundation, we just don't think about it. What is the source of formula milk? Think about it. Second thing, if it is dehydrated milk of some animal milk, some cow milk or something, then do you think that much milk is available in the world to suffice adults' milk requirement and babies' milk requirement? It is all synthetic, girls. Think about it. It can't be natural. Second thing, the most important thing is immunity, immunoglobulins. When you are feeding your child, though that milk is made in your body, and your baby, your body has carried your baby for 9 months. Though the DNA is recognized by your body, the body will make a tailor-made milk for your child. Okay, so there is no comparison when we talk about breast milk and formula milk. Okay, so Nehal, I hope I am clear. And still, if you have any question, please write. I would really like to answer this question because this is something which I really feel every mother should understand, every lady should understand, and should motivate mothers to confidently breastfeed their babies. And when I always say that if you are facing any issues with breastfeeding, see, I am not against formula milk. That is a lifesaver for many babies. Work on breast milk. If you can, then there is no point in just giving formula milk because I don't want to breastfeed. Just don't think that way. Or just thinking that formula milk has everything. What is the use of giving breast milk? No. If you can work on it, if you can improve the milk supply, and as I tell that even relactation is possible. And I gave you the answer of about 2-year-old baby's mother. We could increase breast milk even for 2-year-old baby. So what is stopping you from giving breast milk to your child? Yeah, it is a lifesaver, but there is also option of improving milk supply. Next question is from Meenal. I am not able to follow the protocol religiously due to some problems at home. Can I still see results? I'm not sure, Meenal, because I don't know what is your current status, but I would suggest, my dear, this is a small time. Your baby will grow very fast. Try to take out time to follow the protocols, my dear. See, if you follow the protocols, I will give you, like, I can like tell you that you will definitely get results. But if you're not following the protocol and you're asking, can I still get results? If I say yes, you will say, Acha, I will not follow the protocols. If I say no, you will get demotivated. So, Meenal, it is better that please try to have time and try to follow the protocols, my dear. It will definitely improve your milk supply and it will improve your confidence. And it is a small time. Your baby will grow to 6 months and will start having solids. And that time, obviously, you have to breastfeed, but the dependency on breast milk will decrease. So it is a small time. Please, Meenal, work on it, dear. Okay, it's a request. Please work on it. Next question is from Alpenlibe. Does high BP reduces the quality of milk? Should we feed them? No, the high BP has no relationship with quality of milk. Okay. And should we feed them? Yes, you should definitely breastfeed. There is no issue about high BP and not feeding the baby. Nihal says, ma'am, does food, example, urad pulse, brinjals have any effect on baby? No. As elders in family say, such foods create gas in the baby due to nutrients get added into the milk and goes to the baby. No, Nehal, this is just a myth. Don't worry. Just have confident breastfeeding. Don't worry about all these things. Next question is from anonymous attendee. My baby is 3.5 months old. I had to be away from baby for 4 weeks due to post-op complications. I'm trying to establish breastfeeding since 2 months now, but no improvement. My express milk quantity is the same. How to solve this? So first of all, please don't worry. You have been following this for 2 months. And if you're not getting results, please, dear, reach out to the team, get your issues resolved by an expert guidance. Don't wait for tips and tricks. Please reach out to the expert guidance because already 3.5 months, your baby is already 3.5 months old. Please reach out to the team as early as possible and get your issues resolved here. Next question is from Divya. Is it possible to correct the latch of 6 months old who was bottle feeding from beginning? It can be worked, but I will not give you 100% guarantee that the baby can latch, but it is definitely worth trying for a 6 months old baby also. Second, now since the baby is 6 months old, can we use straw cup to feed milk and make him forget bottle nipple and slowly try to directly feed him? So straw, baby will not be able to suckle the straw because baby is just 6 months old. The baby doesn't know how to take from the straw. So instead of that, you can just have this cup feeding that can be tried. And there are so many videos on YouTube for cup feeding. And you can just reach out to the team if you want to have a proper video about how to cup feeding. Next question is from anonymous attendee again. Baby do not latch and always sleep during feed. Not much milk is coming. Switch to Nan Pro. So if your baby is not latching because of low milk supply, then I have answered in deep today. Please watch the recording. And still, if you are not able to work by it alone, please reach out to the team and get your expert appointment done so that you can resolve your issue as soon as possible. Next question is from Sana. There is low milk coming from my right breast because of the flat nipple. The baby is not fed and there is no milk coming either. So basically, this is a demand supply game which has happened because whenever you try to breastfeed, but the baby was not latching, and that's why the supply has gone down. So please work on the demand and supply protocol and work on the tips and tricks which I have given today. Next question is from Preeti Mishra. My 2 months old baby gets too cranky when trying mid-bottle feeding. He's formula fed and bottle fed from day 5 of life. What to do? So first of all, if your baby is getting too cranky, then what to do? Don't try for mid-bottle. Just see if 80% of milk you have given and then you try. And obviously in the beginning, it will happen like that. But slowly, if you keep working on that, the baby will start adjusting to the bottle because you also believe that baby has been on from day 5 on bottle. So it becomes very difficult for the child to adjust. Just 1 minute. इसका मुझे ना चार्जर दे दो इसकी चार्जिंग पता हो रही है ये आईफोन इस वाले से So, as I told you, Preeti, so because your baby is habituated to the bottle, the baby is becoming very cranky. So, first of all, just relax. Just try to do the give 70 to 80% of bottle, and then you remove the bottle and try. If still that is also not working for you, in that case, what you do, you start reducing the milk in the bottle. Suppose you give 60 ml, you give 40 ml, and after the baby has taken 40 ml, then you put the baby on the breast. If this also doesn't work for you, then you go for exclusively pumping for few days and keep trying the baby on the breast whenever it is possible, in the sleeping positions, in the other times whenever it is possible, and you can replace the milk with that. Okay, so this way you can just work on it. And you said, I'm trying to get him on breastfeeding, feeling very demotivated. My supply is not good too. Hardly able to express 120 to 150 ml in whole day of by pumping. Working on improving with your team support. So in the initial, when the babies are on mixed feeding, especially when we are trying to put them on the breast from their bottles, then it takes little time because we are not able to give a proper protocol, either not either a proper pumping protocol and not fully mid bottle feeding protocols. That's why it takes little more time in the initial days. But once your baby starts coming from the bottle towards the breast, even for few seconds also, it will motivate you, Preeti. So just don't worry about it. I understand it becomes difficult and you feel like that nothing is working for me. But believe me, just keep working, just keep moving. And the three things which I just told you, go for 80% bottle feeding. Second is just reduce the formula milk in the bottle and then you feed the baby. Third is pumping for right now, just go for a proper pumping protocol and just feed the baby mid bottle feeding or 80% feeding as an extra thing. Keep pumping and just doing that in an extra thing. And once the baby starts coming on the breastfeeding, then you can start reducing the pumping sessions. Next question. So Meenal says, thank you, ma'am. I will definitely do it with all my heart. That's great, Meenal. I am so proud of you, Meenal. Next question is from Jem Brini. Hello, ma'am. My baby is 2 months old, but he doesn't feed my milk. He's struggling to latching. Even now, my milk flow is very less. So what to do? So you all are joining late and asking the same questions. All of you are latecomers. So just watch this recording today. I have given a good detail about low milk supply and latching things also. Next question from Nehal. For express milk, do we feed via bottle or via katori spoon? So if you are trying to put the baby on the breast, then if the baby gets habitual to the bottle, it becomes difficult sometimes to get them on the breast from the bottle. So if possible for you, you can go for katori spoon. And if you have to go for bottle itself, and yes, Preeti, it applies for you also. Both of you should listen. So what you need to do for bottles, there are paste bottle feedings. So low paste bottles. So use the low paste bottle so that the baby doesn't get habitual to bottles and can come on the breast. Third thing, also you need to see what is the flow of the bottle. If it is a high flow, the babies will not come on the breast easily because they understand, they get habituated to the high flow of the bottle, and that flow will not be there on the breast and that will make them cranky. So two things you have to do. You have to take the bottles which have slow paced feeding. Second thing, the nipple should be having small, you go for smaller size nipples size, so that whole of the nipple should be smaller size, so that there is not lot of milk coming for them with a good flow, so that they don't come on the breast, because the flow of the breast will obviously, a high flow bottle will not be able to match with the breast flow. So that's why you have to work on these two things. Both of you listen, Preeti and Nehal. Okay. नेक्स्ट क्वेश्चन फ्रॉम राधिका. मेरा बेबी 6 महीने का है, उसका वेट ही नहीं बढ़ रहा है, क्या करूं? 6 महीने का है तो खाना भी स्टार्ट करो, 2 बार खाना दो उसको, बाकी ब्रेस्ट फीडिंग कराओ. खाने की चीजों में बहुत सारी चीजें हैं जो आप बच्चे का वेट बढ़ा सकते हो. मेरे पास एक डाइटिशियन है जो कि बच्चे के लिए वेट पूरा बच्चों के डाइट चार्ट बनाती हैं. आप कल रीच आउट करो टीम को, उनके साथ अपना डाइट चार्ट, बच्चे का डाइट चार्ट बनवाओ, प्रॉपरली फॉलो करो और बच्चे का वेट जरूर जरूर बढ़ेगा. ठीक है राधिका. Next question is from Dan Kaur. My baby only latches from right side of the breast. If I offer from left side, my baby starts crying. I already answered this, Dan. Next question is from Amrita. Ma'am, can I give baby formula feed after my breastfeed as my supply is not sufficient? Yes, you can give, Amrita. Next question is from Nishat. Hello, ma'am. My baby is 4.5 months old. I regularly pump and feed my baby. Sometimes I miss 1 or 2 sessions, then the milk becomes watery. Can I feed that milk to my baby? Yes, Nishat, definitely you can give breast milk, either watery or thicker, whatever. You can definitely give to your child. Next question is from Tanima Bhattacharya. Oh, sure, you are live here. I caught you, Tanima Bhattacharya. So it's the same name, girl. So it is always a pleasure to see because Tanima name is not very commonly found. So I like when I have mothers who are same names. Okay. So Tanima says, is skin to skin touch really important to improve milk supply? My daughter hates to be near the breast as my milk is very low. Should I put her on my breast when she's sleeping or dream feed her? So skin to skin doesn't mean that you have to put the baby on the breast for feeding. With skin to skin means you have to just open your chest, open baby's clothes and keep the baby skin to skin with you. That doesn't mean that you have to take the baby on towards the breast. Okay. So skin to skin just means keeping the baby's chest skin to skin with you. Okay. Next question is from Nishat. Can you please tell about oil massage? How to do and then how to clean up as it is recommended 3 to 4 times to do in a day. So Nishat, I think that you are our regular patient because when you know the how to do, like how many times to do, please reach out right now itself. Just message to the helpline team to send you the oil massage video. She will send you tomorrow morning, definitely. So Nishat, just ask her because I have made a very good video on how to do oil massage and warm compress. So just message her right now to the helpline team. She will send you tomorrow morning. Okay, Nishat? Next question is from anonymous attendee. I have started your product 1 week ago. I have some results, but baby is not coming on the breast. It's okay, dear. So it's just 1 week. Just keep working on it. Just keep patience. And baby is coming on the breast. See, you people think that babies are like cuties. Whenever you try to them put them, they will come easily. It's not like that. You have to keep patience and work on it regularly. Next question is from Pratibha. Can I use Promolac tablets regularly? It is suggested by my gynec. So I would suggest please ask your gynec about it. Next question is from anonymous attendee. My son, 2.5 months old, who has been bottle fed for the past 25-30 days, suddenly he is not taking bottle and only wanting for breast milk for the last week. I'm unsure of my milk supply. He has been feeding every 2 to 2.5 hours during the day and sleeping 4 to 6 hours straight at the night. Is this normal? Yes, it is definitely normal. You just need to see the weight gain of your child. If your baby is gaining around 150 to 200 grams per week, you are going good, great. You're doing very good. So just keep working on it confidently and you are doing so good. And don't worry, I love your child who is rejecting the bottle and coming on the breast and wanting breast milk. I love your child. Give some 2 extra hugs and 2 extra kisses from my side to your child. So next question is from Janani. Hi ma'am, my 40 days old baby didn't poop for more than 10 days. However, he passes urine immediately after breastfeeding and he farts also. Please suggest me how can I make him poop naturally. So first of all, Janani, if your baby is having good weight gain, then it is perfectly fine. But I believe you need to see the weight gain because I feel the weight gain is less for your child. Please see the weight gain and reach out to the helpline team tomorrow. If the weight is good, then nothing to worry. If the weight is less, you need to give more hind milk to your child so that the baby starts pooping regularly. Because 10 days is a long time. Like for 6 to 7 days, it is fine, but 10 days is a long time where the baby has not pooped regularly. Next question is from Bhavna. My baby is not latching properly, although my breast is having milk. What should I do? I already answered this, Bhavna. I think, Bhavna, I answered this question last time also. You missed that because I was thinking that this question I answered last time also. So please see on my last week's recording, last like sessions recording. I've answered this question in deep, Bhavna. Next question is from Kajal. How do I know that baby's stomach is full after breastfeeding? Already answered, Kajal. Kirtana, hi ma'am, my baby is 2 months old. I am getting only 60 ml milk even every 2 hours during pumping. Baby doesn't sleep from morning till night. Is the supply sufficient? Urine output is above 12. So urine output you don't have to see. You are getting 60 ml per every 2 hours by pumping. Baby doesn't sleep from night. So two things you have to tell me. Is your baby taking formula milk? Second thing, what is the weight gain in 1 week? Tell me that and then I'll answer this question. Next question is from Preeti. My baby uses breast as a pacifier and falls asleep. Is this habit healthy and can it stimulate brain to increase supply? He is mostly formula fed and I'm trying to increase milk supply. So Preeti, if your baby is using breast as a pacifier and if you're having problem with that, then obviously you need to work on it. But if you're comfortable feeding the baby, you are able to sleep with your child on the breast and you're okay with it, then it is perfectly fine. So this thing of baby coming on the breast and sleeping on the breast, this has two angles to it. If the mother feels uncomfortable, then obviously you have to work on it. If the mother feels okay and she feels good to have her child close to her during her sleep, then it is perfectly fine. So there are always two angles when we talk about. One is what the mother feels and one is what the consultant feels. So we have to always take a midway where both the consultant and the mother is happy. Okay. Next question is from Preeti again. I only get watery milk, probably the foam milk, after 10 to 15 minutes of pumping, and the flow stops. And am I doing something wrong? That means you're not doing massage and the compress regularly. Preeti, just see what your doctor has advised for the massage and the compress. I think you are missing the massage and the compress. If you are doing it properly, please write down. I'll answer this again. Next question is from Kushali. How to increase breastfeeding? I have already answered this, Kushali. Just watch the recording, dear. Next question is from Aarti. Hi, madam. My baby is 51 days old, C-section. I'm giving him formula milk twice, approximately 120 ml. I want to make it zero. How can I do that? I also take Zandu Satavrix. How long should I take it? So first of all, Aarti, for improving milk supply, I have answered in detail today. Please watch the recording. Tomorrow it will be available on YouTube and also on Instagram. So you can watch either ways and then the tips you follow and still first follow for few days. If you are able to improve, that fine. Then otherwise reach out to the team because the baby is just 51 days old. You can definitely improve the milk supply faster. Question is from anonymous attendee. Will not feeding from abscess in breast? How long to empty the breast? In how many months it stops completely as baby is on feed? I'm not able to. You have abscess in breast. Was it cleaned out? If the question is not clear, dear, please write the question again. Question is from anonymous attendee. Can we store colostrum and breast milk in bottle? Yes, definitely. Nishat says, my baby is 4.5 months old, never latched. I'm trying to bring him on the breast, and when he asleep, he comes on the breast, but still he just suckles the nipple. When I try to latch properly, he gets irritated. What to do? So if you're trying to bring him on the breast from the bottle, then please don't irritate him. First, get him habituated to the breast. Slowly, once the baby starts getting habitual to the breast, then you can start to latch the baby properly. For now, don't irritate him. Let him feed however he is coming. The main right now, the main goal is to get the baby on the breast first. Next question is from Ankita. Can you please suggest any low paste bottle? You can just see, I think Philips Event has a low paste bottle. Preeti says, yes, ma'am, I'm doing the massage. Probably not very effective. We'll get in touch with helpline team for the massage videos. Thank you so much for answering my questions. Looking forward to achieve my breastfeeding goal. Fingers crossed. Awesome, Preeti. I am definitely, I am like very confident that you will definitely get results, Preeti. Don't worry. Okay. This sign is good. How to make it? Yeah, like this. Love sign. Okay. I learned it from my kids, so now I understand this love sign. Okay, so now let me, oh, here, there's so many questions here also. Okay. तुम लोग कितना जल्दी जल्दी मैसेजेस कर देते हो भाई, मुझे ऊपर जाना पड़ता है. Okay, so मैम माय बेबी इज लैचिंग. ये कैसा नाम रखा है? फ्रेंड्स कॉल मी पॉटी. क्या मतलब कुछ भी रखोगे भाई, तुम लोग अच्छा नाम रखो. Ma'am, my baby is latching, but when I try to burp, she vomits and again crying for milk. Even after giving drops, also same thing happens. So let's see that there might be some this thing, protein intolerance, lactose intolerance. So please see, check it with your doctor if your baby is having any kind of lactose intolerance, because even after giving drops of milk, if the baby is vomiting, that there might be some intolerance issue. Please reach out to your lactation, your pediatrician once. Radhika says, thank you, ma'am. Most welcome. Nehal says, thank you so much, ma'am, for clearing all my doubts. In your next live, I'll definitely share my experience, which will be positive, I'm sure. Awesome, Nehal. Yes. So Bhagya says, after feeding my baby got hiccups, what to do, ma'am? So if your baby is having, see, hiccups is normal. If the baby is having hiccups, it's perfectly fine. Don't worry about the hiccups. राधिका सेज मैम डाइटिशियन का नंबर शेयर करो ना. डाइटिशियन हमारा देखो, आप हेल्पलाइन टीम को रीच आउट करो, वो आपको कांटेक्ट करेंगे. अगर आपको नंबर नहीं पता है मेरी इंक्वायरी टीम का, तो आप डीएम कर देना. मैं आपको ऑल्दो आप डीएम करते हो तो आपको एक डायरेक्टली एक ऑटोमेटेड मैसेज भी जाता है. वो आपको हमारी इंक्वायरी टीम का नंबर है, आप उनको कांटेक्ट करोगे, वो आपको डिटेल्स दे देंगे. Atisha says, my baby is 14 months old. Yes, I remember, Atisha, you wanted to wean off, but we have discussed about it. Please just go ahead with an informed decision, Atisha. Yashmita says, how to increase breast milk? Baby is 25 days old. Baby is not sleeping continuously. So, Yashmita, please see the recording, my dear. I have answered in detail how to increase breast milk. So Atisha says, my baby is 14 months plus. I breastfeed him once only and night when he cries. I want to stop night feeding. Can I feed him in day anytime, or the time should be same every day? It will all see, every child is different. Every mother is different. Try doing this thing and see what helps. And then we can discuss in our next live. Okay, Atisha, just work for this week on this. And then we'll talk about this more on our next live. Desi Brahmi says, ma'am, I'm big fan. Awesome. I love you girls. When you say, I get flattered by all of your these kind of lovely comments. It flatters me. Thank you. Thank you so much. Yashmida says, ma'am, baby is not sleeping continuously and crying in the night, and I guess breastfeeding is not sufficient. Kindly help. Then obviously, see, if you are feeling that supply is less, then just work on the tips which I have given today. And still, if it doesn't help, please reach out to the expert. But first try whatever I have told. Okay. Supriya says, ma'am, if baby is not burping after breastfeeding, is that means he is not full? अरे नहीं ना बाबा, ये कहाँ सुन लिया सुप्रिया? It is nothing like that. So next question is from Kanza Faizan. मुझे periods हर महीने 15 days late होते हैं. It's a problem. Is it a problem? नहीं. अगर हमेशा ही ऐसा होता है तो it is not a problem. सब हर का साइकिल डिफरेंट होता है ना. किसी का 28 डेज का साइकिल होता है, किसी का एग्जैक्ट 1 मंथ का साइकिल होता है, किसी किसी का 45 डेज का साइकिल होता है. तो अगर आपका रेगुलरली 15 डेज लेट होकर के आता है, यानी आपकी 45 डेज की साइकिल है, विच इज परफेक्टली फाइन. Question is from anonymous attendee. My baby took only formula for 5 months. Is it possible to bring to breast now? Can be tried. I will not say that definitely you can bring a 5 months baby on the breast, but it is always a worth try, because recently my one 10-month baby and one 4.5-month baby came on the breast back. So yes, you can try, but this is not a sure shot that the baby will come on the breast. But when we talk about milk supply, that can be increased for any age of the child. For improving milk supply, that is not a problem. But when you talk about if the baby has been on bottle and now you're bringing the baby on the breast, then there might be both the things. The baby might come, the baby might not come. Okay, but for milk supply, that can definitely be increased. Yashmita says, lumps in the breast is a problem if baby is leaving milk. How do we empty breast? Nothing. You don't have to empty the breast totally. Just hand express by doing oil massage and warm compress, and whatever extra milk will come out. If you're having lump issues, that means you have good milk supply. Just do, Yashmita, what I'm just suggesting right now. Kanza says, मेरा baby है 1 year का feed करवाती हूँ. Okay, that's great. Okay, girls, so we are done for today. It was whooping 1 hour 45 minute session. So all of you who have joined late, please watch the recording. Today we have discussed lot of questions. आज हमने बहुत सारे questions discuss किए हैं. So जिन्होंने late join किया है, please watch the recording and you will get answers for most of your questions. And from next time, please join at time. प्रॉपरली मैं 8 o'clock 8:05 के बीच में मैं स्टार्ट कर देती हूँ सेशन. सो नेक्स्ट टाइम ऑलवेज बी ऑन टाइम सो दैट वी कैन हैव योर क्वेश्चंस रेगुलरली, लाइक टाइमली. कुछ जो आ रहे हैं आई जस्ट आंसर, बट सोचो यार, 1.5 घंटे से मेरे को बिठा के रखा है तुम लोगों ने सबने, मतलब आई सी, मतलब मैं अपनी मर्जी से बैठी हूँ बट स्टिल, इसलिए तो टाइमली आ जाया करो जिससे हमारे क्वेश्चंस इजीली सॉल्व हो जाए. So Meenal says, ma'am, is there a minimum or maximum time the baby should breastfeed? My twin sons do not leave the breast on their own. So you have to see, Meenal, whether they are doing active feeding or passive feeding. So if they are gulping and you are seeing an active feeding, you can continue breastfeeding. But if you are not seeing the gulping movement, that means they are just doing a passive feeding. You have to remove them. Okay, Meenal? Kavita says, my baby is 7 months old. He's not taking grains. He's taking only formula milk. What to do now? How to feed him? So we have our dietitian in our team. Please reach out to the team tomorrow. If your 7 months old baby is not taking grains, only formula milk, then obviously you have to give complementary feeding to your child. You should start giving solid feeds to your child. Please reach out to our team tomorrow and take guidance from our dietitian, and she will definitely guide you about how to give solids to your child. क्वेश्चन, वेट गेन करने का बता दें तो बच्चे का एज क्या है, बच्चा फॉर्मूला फीडिंग कर रहा है, मदर फीडिंग कर रहा है, सॉलिड्स खा रहा है, कुछ तो बताते नहीं हो तुम लोग, बस सीधे क्वेश्चन पूछ लेते हो. ओके, चलो. सो वी आर डन फॉर टुडे. एंड अभी जो भी क्वेश्चन जिसके बचे हो अगले लाइव में लेना, आज ऑलरेडी 1.5 घंटे से ऊपर हो गया है. We'll talk more on the next session. Although I think I have answered everybody today. Okay, so take care everyone and watch the recording. The recording will be there and it will be both on Instagram and on YouTube. Take care, girls. Bye-bye.